today's video, I have a patient, a real patient. This patient came in with a very unique diagnosis. It's something that I want you to see because one of you out there at some point in your life is either going to have a friend or a family member, or maybe you might even have this problem. And the problem is Bell's palsy. Bell's palsy is basically a weakness of one side of the face that we'll talk about after we see this patient scenario. I want you to pay attention to the patient, the way he's talking, and look at particularly the left side of his face, and you'll notice the weakness, and then you'll see what's going on. After the little bit here, I'll tell you a little bit more. All right, ladies and gentlemen, welcome to another day in the emergency room. Dr. Moses. I have a wonderful patient here, but I can't remember his name, so I guess he's gonna remain anonymous, right?
Absolutely.
All right, that's good. So, tell me what happened. What did you notice? Come on closer. Tell me, what did you notice, and when did you notice that what happened?
Probably last week, Sunday. My eyes started twitching a little bit.
Twitching?
Started,
Okay.
just twitching, and then I went to bed like normal.
Okay.
Wednesday, it started affect me more and more and more. My eyes started twitching more and more.
Okay.
Went to bed, woke up the next morning, Thursday morning. Face, as you can tell, is just completely numb on one side.
Okay.
To where no movement of anything like that. So.
On the left side.
Yep.
And so this was about a week ago, right?
This is Monday now, so last Thursday, 4 days.
4 days. Okay. Why didn't you come to the emergency room like the day you noticed a problem?
I thought it would go away.
Oh,
People out
okay.
there. I just thought it would go away.
So you didn't have any high fevers or anything like that? Come a little closer and focus on him. And so you didn't have any fevers or anything? No?
No fever, no.
All right.
Nothing like that other than just no movement on that side of the face.
On that side, okay. Let's just see what this is, guys. Go ahead and take your glasses off. And then try to close your eyes really tight. Let's see what we got. So you notice that the left eye isn't closing totally all the way. And you said you wear contact lenses.
Yeah.
What are you doing? Because your eyes look pretty good. So you must be doing something so they don't get too dry.
They have at Walmart just Gentile. I don't know if you're supposed to use brands, but anyways.
Okay, it's all right. You can say whatever you want.
Yeah, I just put it in there at night, and I use that for my contacts, and it carried over into using it now. And
that's how you kept your eyes good.
Yep.
So this guy's a genius, people, because most people who have this kind of problem, they don't know what to do with their eyes. So now here's the next thing, and I want you to say it because you get to take the credit. What do you have?
Bell's palsy?
How did you figure that out?
WebMD.
My
wife.
You figured it out on WebMD?
Yep.
How did you, what did you Google? What did you do?
I woke up, I'm like, hey, wife, my eyes aren't working or nothing. So
Okay.
she's like, hey, let me.
Yeah?
Told me the first thing on the list, and the symptoms worked and matched.
They all matched up.
So this video helps with that also.
Okay.
So.
All right.
Pretty awesome.
That's good. So you used your phone or your computer or
phone? Yep.
Phone. You used your smartphone to look up your symptoms, and you kind of figured it out. So what did you come here for me?
I needed that approval, that
confirmation.
My wife's 100% right. I'll tell you that. But I needed that doctor's 110.
Okay. All right. So what we did when this wonderful man came in the door was we assessed him, and it was funny because he kind of. I think it's Bell's palsy, and I said, oh, interesting. I think you might be right. But what we did is, so Bell's palsy is weakness of one side of the face. And usually it's the whole side of the face, whichever it is, which is a result of a problem with the facial nerve which goes to that side of the face. So one of the things that I did while I was checking him was I wanted to see, can you feel if I touch one side of your face or the other? And he can. He totally can tell sensation. The only thing is he just can't move it. So that is one of the things that we look at from a doctor's standpoint to figure out, okay, what's causing the problem. But of course, and I know you guys are wondering this too, and it's a legitimate question, what if it's a brain tumor?
Yeah.
Right?
Yep.
So yeah, we did a CAT scan of his brain. I looked at it myself, no brain tumor. We also checked his blood to see if maybe it was some kind of a crazy infection or something like that. No crazy infection as far as like something that shows up in the blood.
Yeah.
You don't have any anemia or just nothing that showed up in your blood abnormal. So when you check, yes, yeah, that's really good.
That's really good. Yeah.
So when we, as the doctors, check you for these kinds of things, and we're like, you know what, it's not a brain tumor, it's not this, it's not. We go through kind of like a process of elimination to look at the worst possible things it could be. We're like, it's not any of those things. It must be Bell's palsy.
It's gotta be.
Yeah, because Bell's palsy is actually. Is there something that we can use to actually diagnose Bell's palsy? Do we have like a blood test for Bell's palsy?
I don't think so.
No, there is no blood test for Bell's palsy. There's no any test. At least not that I'm aware of. If you guys know something, you tell me. But as far as I know as a doctor, there's no real test. So we kind of have to go through this process of elimination where we kind of check all the things that it could be and make sure that's not it. And then we come to the conclusion, which is what you came to when you walked in the door. You had it. All right, keep doing your thing. Thank you for teaching the world.
Thank you.
All right. All right, so you saw the video and you saw the patient, and I'm sure you noticed the weakness of his face. And I was actually very impressed that this guy, he figured it out. Or, sorry, his wife figured it out. I'm trying to figure out now, is that a good thing for us doctors when you figure out what's going on, you come in and tell us? You know, I'm going to say I think it's kind of good, but I think it's more appropriate for you, the patient, to come to me, the doctor, with kind of an idea of what you think it might be, and then present that to me, the doctor, and let me kind of use what you're giving me, let me examine you, and then try to figure it out. Now, just so you know, this particular guy, he did nail it, he did figure it out. Bell's palsy, let me try to define that. Let's come over here and take a look at some pictures. This is an anatomy book that I know fairly well. Let's go to, you know what? We're gonna go to the face. All right, so the face basically has one nerve that goes to all of the muscles on one side of the face. That nerve is called the facial nerve, or the seventh cranial nerve. In this particular dissection here, we can see the facial nerve has been dissected out, and you can see each of these little yellow branches going to all of the different parts of the right side of this individual's face. So what happens with Bell's palsy is, now I have to give you a little bit more of a description. So what happens with Bell's palsy is, inside of your brain, you have 12 nerves that we refer to as cranial nerves. I'll have to talk about that whole thing in probably another 10 different videos because it's kind of complicated. But you have 12 nerves that come out of your brain and go to different parts of your head and neck, mostly. The seventh one is called the facial nerve, and that's the one I just showed you with those little yellow branches coming out like this. In a person who has Bell's palsy, somewhere from the brain down to whatever the passageways the nerve has to go through inside of the skull, and then coming out here, we as doctors feel that the nerve gets pinched. And anytime a nerve gets pinched, it's kind of the same thing as if a wire turns or gets shorted out or pinched and the electricity goes off to the room that you're in. Same thing with a nerve. If you pinch a nerve, whatever that nerve was doing, it doesn't do anymore. So if you pinch the facial nerve as it's coming out of the brain and going to the face, whatever the facial nerve does will stop doing. And so in this particular patient that we just saw, his facial nerve was pinched somewhere along that pathway. And as a result, the whole side of his face was paralyzed. In a person who has this, the biggest thing that I'm concerned about is, can he close his eye? Because if he can't close his eye will dry out, and you only have two eyes. And if they dry out, you've seen what things look like when they dry out. And you can't go backwards from that. So it's very important not to let your eyes dry out. And you recall from the video that this particular patient, he had it all figured out. He kept his eyes moist even though he couldn't close it. So I think, without getting into too deep of a discussion, I would like to say that facial nerve paralysis that occurs with Bell's palsy is something that we as doctors don't know exactly why it happens, but it does happen. And I think my recommendation for you will be, if you or yourself or a family or a friend have sudden weakness on one side of your face, don't wait so many days to come in like my patient did. Please come in within 24 hours or less, because there's a lot of other things that can cause facial nerve paralysis. Brain tumors, bleeding in the brain, infections in the central nervous system, other things that are also very bad. And if you come to see us, the emergency room doctors or your doctor, we can try to figure that out for you and then help you understand what you're dealing with and how to deal with it. And I think that's all I'm going to say for today.